Good afternoon. Thank you for tuning in today. My name is Jeff. We're going to talk about solving virtual care myths. We're going to look at the idea that virtual care means video. Not at all true. We've talked about that a little bit in the past, and we're going to show you a quick demo to look at how SecureMail can be used to focus your virtual care through the clinic. Before we do, we're going to just put up this quick bit about audio settings. Make sure, if you can, you're doing computer or that you are dialed in so you can hear us. With me today is Mark Ayer, our Director of Customer Operations. Mark's going to take us through a demo of some new features that were just released today to help you focus any SecureMail messages through the clinic, through your virtual front desk. So that's a very nice sneak peek, fresh off the presses. And so looking at this myth, so video is the most common way to conduct virtual care. It's not actually true. And if you look at the statistics of how clinics and different healthcare organizations operate with virtual care or telehealth, the majority of what they're doing is secure messaging. And we'll look at some reasons for that. So SecureMail actually increases the efficiency of communication. We all use email and text in the run of our day. The default, instead of calling someone now, is sending them a text message, or at work we're sending them an email, because we know that we don't have to worry about them not picking up on the other end. We know that if we send them a message, they will get back to us, and we've done our part. We've communicated what we need to communicate. In that sense, that's because secure messaging does not require scheduling. So SecureMail is very much like regular email or text messaging. People can send inquiries and responses or replies as is convenient for them, as works with their schedule. So you're not worried about aligning two different schedules as you would be with a video consult. Now, there is definitely time when a video consult in terms of virtual care would make more sense. Certainly if you needed to see a patient, have them show you something. Other times it might just be more appropriate. They might need that sort of eye-to-eye, face-to-face contact with the physician. SecureMail is also less demanding on staff time. So when we talk to clinics that use SecureMail more, they see staff retention go up because people are more satisfied at work. You end up with a less frantic environment because you're not always being pulled to answer the phone. What people end up doing is they schedule or structure their day around a certain time. I'm going to check our SecureMail inbox at 8. I'm going to check it at 10:30. I'm going to check it at 1. And then we can reply at that time, and you know then when you're going to do those batches, and you're not worried about being pulled away from a task to answer a phone call, and you're not leaving somebody on hold while you're finishing a task because you can't answer that phone call. So there's fewer interruptions. And secure messaging is actually shown to improve health outcomes. There's a lot of different reasons for that. Primarily, though, it has to do with treatment adherence. So we actually did a webinar this week for patients. We had a number of patients tune in, and the patient that we had involved in presenting discussed a lot of different scenarios, and that he goes back and references different conversations he's had with his doctor or his clinic, just as a reminder of, oh yeah, that's what I'm supposed to be doing. And that also ends up with less traffic coming into the clinic, fewer phone calls for reminders or check-ins, or hey, can you remind me what I was told at my last visit? I can't remember what I was supposed to be doing. It's all right there in the SecureMail message. So people are able to follow what they're supposed to be doing more closely. And patients do prefer SecureMail over phone the majority of times. Patients, they see it as quick. They don't have to make a doctor's appointment if they don't have to, which is great for both parties. We're not clogging up the clinic unnecessarily, especially nowadays. We want to make sure that we're keeping people away from the clinic as much as we can. Communication is faster, right? It's nice to have that record, that written record. It's also, paperless. We're reducing the number of envelopes we're stuffing and sending, the stamps we're licking. That's a throwback, I guess, to the old days before all stamps came with their own stickiness on the back. And it's quick and confidential. Patients do appreciate that. When we talk to patients about what's important about it, 95% of patients say that confidentiality is important, and they do expect clinicians and clinics to maintain the privacy of their information. So we're going to take a look at how you actually set up your virtual front desk and some of the features that were added just last night. So this is a quick snapshot of what a virtual front desk looks like. A patient sends a request for care to the clinic, or maybe it's an appointment request, or just a follow-up notification. Hey, here's how I'm feeling now. Any assigned member of the front desk team, the virtual front desk team, who has access to your shared inbox, can now look at that message and decide what needs to happen next. If there's clinical assessment or decision required, if we need to get a doctor or clinician involved in this, we can just simply forward the message. We could type a quick note and say, hey, here's a question from Mrs. Johnson. I'll leave it in your hands, or what would you like me to do with that? The physician can respond back to the virtual front desk, and maybe it's a different person that picks it up and forwards it on to Mrs. Johnson, or makes the appropriate arrangements. Or if there's no requirement for any sort of clinical input, the front desk staff can also address that. Maybe it's just, hey, can I come see the doctor? And they can respond or pick up the phone and say, yep, let's get you in this afternoon or tomorrow or something. So it's just a really streamlined way to flow through with your communications. Make sure that all messages coming in are addressed. And the great thing about using an email-like application is patients already have the expectation that they're not necessarily going to get a response immediately, because we're all used to that type of communication in our day-to-day lives. So let's take a look now at how we get into implementing some of this, and what are the features and configurations within your secure mail account that you're going to want to make sure are set up from an administrative standpoint. Mark, are you able to take over?
Yes, I think I've just started sharing my screen.
You got it? Yep.
You're seeing it okay? Great. So yeah, so thanks a lot. Pardon me, Jeff?
No, I was just saying it looks good.
Okay, wonderful. Thank you very much. Yeah, so further to what Jeff was saying, with that diagram he was just displaying, there's an opportunity within Secure Mail to route messages to your front desk staff in much the same fashion that you would route messages to a team of people using your phone system. For example, when patients pick up the telephone and they call the clinic, they generally are calling the clinic as a concept, or as a location, if you prefer. They're not expecting a particular person to pick up the phone. They're almost certainly not expecting the doctor to pick up the phone. It's the role of the front desk staff, the MOAs, the clinic managers, whoever those people are within your organization that are handling those inbound calls. And to further extend the metaphor, it's not as though one person has the job to answer the phone all the time, and when that person takes a day off, nobody answers the phone. That responsibility instead shifts to another member of the team. Or if you're the type of clinic that is receiving dozens of calls an hour, then of course that workload is divided up amongst several people. So we were able to do the exact same thing within Brightsquid Secure Mail by routing incoming messages to the shared inbox. Now, Jeff alluded to some new features that were released today. Up until yesterday, we could only automatically route incoming patient messages. So when a patient sent in a message, by default, it would be routed here to the shared inbox. But we launched a new feature yesterday that allows us to do the same thing with inbound messages from everyone, patients, other providers, insurance folks, lab techs. All that information can be routed to the shared inbox, which gives us that almost exact or perfect analogy to what we're used to with the telephone, which is all messages come in here and then they get triaged and transferred, if you like, in exactly the same way. So the new feature is found in a user's personal settings. So I'm logged in right now as the doctor in this clinic. It's called the Fauchard Clinic, and I'm logged in as Dr. Pierre Fauchard. And in my settings panel, and under my personal settings, if I scroll down a little bit, you can see these two checkboxes in the section marked Receive Messages. Now, for years, we've had this option to allow or disallow patients to message you. And you can see where Dr. Fauchard has unchecked that box, which, by the way, is the default setting, which means that patients are not able to send a direct message to Dr. Fauchard. If they try, or if they request sending a message to Dr. Fauchard, our system will advise them, Dr. Fauchard does not accept messages directly from patients. Please click here to send the message to the practice instead. So on the patient side of things, and I'll show you this in a few minutes if I have time in the demo, patients are advised, or people are advised, I should say, that they can't send a message directly one-on-one to Dr. Fauchard. We're instead going to route it to the staff, which is analogous to exactly what they're used to with the telephone. One of the questions that sometimes comes up with this feature is, patients really want to talk to the doctor. They really want to have that conversation with them. And we're certainly not discouraging or eliminating that as a possibility. But just remember that every time a patient does talk to the doctor or tells them their information, all of that information is available to the team anyway within the electronic medical record. So we're not breaching any confidentiality. The agreement of confidentiality is between the patient and the practice. It's not, contrary to popular belief, it's not just between the doctor and the patient, it's the doctor's organization, which is the clinic or the practice in this case. Now, the new feature that was launched this morning is this lower one: allow professionals to message you. Right now, Dr. Fauchard has this option turned on, which means that another doctor or an MOA at a different office or an insurance person or lab tech can send a message directly to his inbox, which they may want to do, maybe for referral conversations or some other reason. They may have very good reason why they want to have one-on-one conversations with another professional on the Brightsquid platform. But just for the sake of demonstration, I'll turn this off right now, and then we'll save Dr. Fauchard's settings. So now, with both of these lower checkboxes unchecked, no one is able to send a direct message that will only be visible to Dr. Fauchard. Instead, every message that is sent to him will instead be routed to the shared inbox, which is managed by the team within the practice. Now, speaking of the team, let's go up here to clinic members. And this is the 3-member team that makes up the Fauchard practice. And you can see that we have Clara Barton, our clinic support person, Dr. or Mr. Crichton Brown, who's the radiologist, and then of course Dr. Fauchard himself. That's me. Now, in this example right now, all 3 of our members are monitoring the shared inbox. But let's assume that Dr. Fauchard has found that he just doesn't have time to manage or deal with those kinds of messages. So what he's going to do is expand his own profile and remove himself from the shared inbox. So now, within the organization, we still have 3 people, but only Clara and James, the first 2 listed, are in the shared inbox. So this is the team of people that are assigned to monitor incoming messages through the shared inbox. So again, if a patient or another doctor sends a message to Dr. Fauchard, it's going to be routed to Clara or James. Now, in a typical practice, we'd see a lot more people. This is obviously a demonstration. But one thing I want to point out here is that as your clinic is being set up and in the life cycle and as time goes on, you're going to be adding and removing people from your clinic. So if a new person joins my practice tomorrow, I would simply go to add new user, and we'll give them a pretend email address, test user +55@brightsquid.com. And so what this is going to do is create a new user account for some new staff member. Excuse my typos today. This is going to be Jeff. His last name is McKay, and he's going to be a staff member. Now, what's going to happen here is I'm going to invite Jeff to join my practice. When he does join, because he's a staff member as opposed to being a doctor, I'm going to enable the shared inbox. So Jeff will become another team member who will also be in charge or be tasked with monitoring the incoming messages that hit our shared inbox. You'll notice that the invitation to Jeff is not accepted yet. That's what this orange triangle indicates. But once he does register his account, I'll be able to expand his profile. It's grayed out right now because I can't edit anything until he registers. But once he does, I'll be able to manage all of his settings on his behalf. So I could promote him to administrator, for example, or turn on or off the ability for people or patients, professionals or patients to message him directly. As the administrator, I have that level of control over all the members in my office. Now, one thing that I will caution you against, and we get this question on our help desk all the time, is can I just set up one account and have all my staff share it? And I can't caution you enough not to go that route. Secure mail by design is intended to be used transparently. And what I mean by that is once you start sharing usernames and passwords, the auditability and trackability of any past events kind of goes out the window. So for example, if we had one account and everyone just logged in as Clara, and whether it was Monday or Tuesday, then James logged in as Clara, and if it was Thursday and Friday, Jeff logged in as Clara. Well, a year from now, when we're looking back at the history, trying to determine, who took care of this patient and were the appropriate procedures followed, if every activity is taken by quote Clara, we have no way of knowing who did what and when. So I strongly, strongly advise all of our users to set up accounts for every person so that they can log in as themselves. There is just no reason for the sharing of accounts. It doesn't provide any advantage. It really slows things down. And so if tomorrow I have a temp staff agent come into my office who's only going to be here for a week and a half, there's no reason why I can't add her to my account, him or her to my account, give them a temporary account, and then when they leave, I can simply click delete and expel them from my practice. There's no additional charge for creating staff accounts, so create as many as you need and just keep track that once Jeff leaves the organization, that we delete him. And that's all there is to it. Really couldn't be easier. The advantage again, all the messages come into the shared inbox. Everybody acts on those messages as themselves, and patients get a more rapid response and a more, shall we say, a better experience as to who they're talking to. We want to give the patients the experience that the clinic is taking care of them, but as a bonus, they can see specifically who they're talking to. Let me show you what I mean by that. I'm going to change my point of view here. Jeff, how are we doing for time? Do I still have a few minutes yet? Seems like I've lost Jeff. Maybe he's on mute. I'm going to assume that I can keep talking as long as I want to.
Sorry, you were right. I was on mute. Yeah, we're just a bit over, so let's just wrap it up once you get
Sure.
to this part, and we'll yeah, sure.
So I'm just logged in now as a patient. The interface looks almost the same, but I've logged in as Adam Abel, who's one of my patients. And I'm going to now, I want to send a message to Pierre Fauchard, the doctor at the Fauchard Clinic. But you can see how when I do that, this pop-up message appears letting me, the patient, know that I'm not talking only to Dr. Fauchard. I'm sending this message to the clinic instead, which again is just fine. I'll now go ahead and send that message with the understanding that I'm talking to an organization and not a particular specific person. When I get a response back, now this is a test environment, so the names look a little weird, but I've received this message from Test Clinic, and the name of the sender was Test. So more appropriately, this would say the Fauchard Clinic, Clara Barton, or James Crichton Brown, or Jeff McKay, whoever that is. So as a patient, it's reinforcing that idea that I'm talking to a particular person within the clinic. So Jeff tells me I've gone over time, so I'm going to wrap it up at this, and I'll turn it back over to you, Jeff.
Great, thanks, Mark. And again, anytime that we have, if you have questions, please feel free to reach out to Mark and his team here on the support side of things. You can reach them at support@brightsquid.com, or you can just go to our support portal. Just go to brightsquid.com and hover over contact. I'll get you to the support page, and you can start a chat there or get our number and call us as well. So thanks very much for tuning in today. Let's keep you connected. If you haven't done your privacy risk assessment yet, go get that done so that we can help you show any vulnerabilities you might be at risk. And as we've been talking about for the last couple of months, unfortunately, the risk is heightened these days as cyber criminals try to take advantage of the situation that we're all faced with. So let's see what we can do to help you get protected. Thanks, Mark, for your time today, and hopefully that was helpful. And we'll see you next week.
Thanks, everybody. Good afternoon.